Welcome, everyone, and thank you so much for joining us today. I'm Emily Himsey, the Director of Programs for Grantmakers in Aging, and it is my pleasure to welcome you to this month's Conversations with GIA webinar. Grantmakers in Aging is a membership organization that serves as a network and resource for funders and a champion for aging-related issues and investments. With over 130 members, GIA works to mobilize the social, intellectual, and financial capital required to improve the experience of aging now and in the future. I want to welcome our partners on today's webinar, Grantmakers in Health, who for more than 40 years have supported health funders of all sizes and interests through education, networking, and leadership. And I want to thank our Conversations with GIA webinar series supporter, the John A. Hartford Foundation. Since 2017, Trust for America's Health, with the support of the John A. Hartford Foundation, has led the age-friendly public health systems movement to make the health and well-being of older adults a public health priority. This work has spread to multiple states, including Florida, Michigan, Mississippi, and Washington. Today, we are focusing on the work of two of those states, Michigan and Mississippi, where the age-friendly ecosystem is expanding. We have a great panel for today's conversation, and joining us today includes Claire Tanner, the Director of the Center for Data Management and Translational Research, and Jesse Jones, Manager of the Office of Public Health Improvement, both with the Michigan Public Health Institute, along with Kina White, the Director of the Office of Community Health Improvement with the Mississippi State Department of Health, and Megan Wolf, the Senior Policy Development Manager at Trust for America's Health. We will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio recording. Watch for an email to be sent within a few days. We also invite you to join in the conversation by asking questions of our panelists, and you can do that by typing your questions into the Q&A box at the bottom of your Zoom platform. I will be collecting those and will address those with our panelists at the end of today's hour. So with that, I am pleased to now turn it over to our panelists, and we will start with Megan Wolf. So thank you so much, everyone, and looking forward to the conversation. On to you, Megan.
Great. Thank you so much, Emily. Good afternoon, everyone. Thank you so much, Emily, for inviting us to be part of your webinar series and to talk with you today about Trust for America's Health's age-friendly public health systems movement and to set the stage for the exciting work that's happening in Michigan and Mississippi. Next slide, please. So for those of you who don't know us, TIFA is a nonpartisan, nonprofit public health policy research and advocacy organization whose mission is dedicated to promoting the health of all communities and working to make the prevention of illness and injury a national priority. We envision a nation in which the health and well-being of every person and community is a national value, and where prevention and health equity are foundational to policymaking at all levels of government. We're most well known for our reports, which cover a broad range of public health topics, including the chronic underfunding of the public health system and need for modernization of public health data and infrastructure, and our Pain in the Nation series, which addresses the rampant deaths due to the opioid crisis. And all of our reports can be found on our website. Next slide, please. So I know I don't have to spend a lot of time with this audience on the growth of the older adult population in the US, but I do want to emphasize that much of the health advances that have contributed to this growth are population health or public health interventions. These include vaccinations, clean water policies, seatbelt and anti-tobacco campaigns, maternal health, nutritious food. There are a lot of advances in our society that are attributable to the public health sector, but many of these are kind of hidden and unacknowledged at this point because we've come to accept that they are part of our lives. Next slide, please. So I also want to point out that just thinking about the numbers is we're thinking about the numbers is good, right? The growth in the population, but we're not quite getting the full picture because the population of older adults is also growing more diverse. In the past 10 years, racial and ethnic minority populations grew from 20% of older Americans in 2009 to 24% of older Americans in 2019, and is expected to increase to 34% of the older adult population by 2040. 34%, that's pretty astounding. Now, because poverty and structural racism are more prevalent in minority populations, we need to understand the health impacts of poverty and racism that accumulate over time and can lead to greater vulnerabilities and health inequities in older people. So I just wanted to lay that foundation for our work as well. Next slide, please. And for those of us with family members who are growing older, for all of us who are growing older, we're well aware that many face chronic conditions. Many of us face chronic conditions as we age. You can see on this chart the percentages of adults age 65 and older that are faced with these health challenges, which are very costly to our healthcare system and our public health systems. Next slide, please. And prior to COVID-19, the federal government's public health focus on older adults was very limited to CDC's fall prevention, chronic disease and healthy brain programs. And of course, the Administration for Community Living, or ACL, provides funding for the aging services sector to help older adults, but none of that funding is available for the public health sector. Then when we get to the state level, very few states collect comprehensive data on older adult health, and few state departments of health include a healthy aging as a core function as represented in a state health improvement plan, and few provide funding or support for a state level coordinator for healthy aging programs. Then along came COVID-19, which thrust both the public health sector and the need to address older adult health right into the center of the public's eye. According to CDC data, 92% of deaths attributable to COVID-19 occurred among adults age 65 and over. The public health sector was called on to help ensure vaccinations at home for those who needed them, to address challenges like social isolation, and to partner with the aging services sector to expand meal deliveries for older adults who were not able to visit their local senior centers and other congregate facilities. Public health also worked with long-term care facilities to educate them on infection control and the use of PPE, or personal protective equipment. Next slide, please. We believe that public health can continue to contribute to longer lifespans with more preventive services, including addressing social determinants of health and dismantling structural racism. Other areas that public health practitioners are beginning to address for older adults include supporting family caregivers, ensuring that emergency preparedness plans include older adults and caregiver needs, finding solutions to rural health challenges like transportation and access to broadband, and even in some cases, clinical health services, and preventing elder abuse. Next slide, please. The age-friendly public health systems work started with the question of whether there were roles for public health and aging, and whether the aging services sector would welcome public health engagement. The answers to both of those questions was yes. So then we set out to identify what an ideal age-friendly public health department would look like. And we came up with these kind of six bullets. So leadership is so important, dedicated staffing, dedicated funding for broader healthy aging programs, a state or community health improvement plan that prioritizes healthy aging. Formal collaboration would be very helpful. That ever important data, a comprehensive data dashboard on older adult health information, and of course, emergency preparedness planning. But with health departments that weren't doing this work, we needed to ask the question, how do we help them get there? So next slide, please. On this next slide, you will see the framework that we developed, and all of this work and the development work has been sponsored by the John A. Hartford Foundation. They've been a wonderful partner, connecting us with other components of the ecosystem and other grantees, and are really, really invested and heavily committed to this work. So we developed the framework. We started with 5 C's. We revised it over the last couple of years to be a 6 C's framework for healthy aging that provides the outline for public health departments to use to guide the transformation into becoming an age-friendly public health system. The 6 C's can be used to explore and expand public health practices, advance partnerships, expand engagement at all levels of government, and address social determinants of health and equity. Next slide, please. So in phase one of this work, we set out to test the framework with a pilot in Florida, where we worked with about 2/3 of the state's county health departments. After working with them for a few months and asking them to kind of envision what age-friendly public health would look like in their jurisdictions, all of them adopted and implemented new policies, programs, and activities to expand the public health role in aging. We also helped to facilitate the development of the Aging in Florida dashboard, which we think is the most comprehensive older adult, has the most comprehensive older adult data in the country. Phase one also included building a national network of partners to explore and expand public health engagement in healthy aging. Next slide, please. Phase two of this work included expansion of our engagement in Florida, which we've expanded now to about 50 of the 67 county health departments that are doing this work. More intensive APHIS adoption in Mississippi and Washington state, and you'll hear more about the Mississippi activities from Dr. White in a few minutes. And then we partnered with the Michigan Public Health Institute with funding from the Michigan Health Endowment Fund to advance age-friendly public health there, and you're also going to hear about that great work in just a bit. This phase included expanding our partnerships with the HHS Office of Disease Prevention and Health Promotion and CDC, working with the Public Health Accreditation Board to add a life course approach to public health accreditation standards, and developing some new tools for public health, including the most recent one, the Indicators of Healthy Aging Guide, which is intended to aid public health and community partners in ensuring older adults are included in community health assessments. And all of these resources can be found on aphis.org, afphs.org. Next slide, please. We also launched in phase two an age-friendly public health system recognition program. Our recognition program is not designed as a prescriptive process, but one that really is intended to honor the engagement of public health departments in healthy aging. I'm very happy to say that the Mississippi State Department of Health has recently become recognized as an age-friendly public health system at the exemplar status. So we're very, very proud of the work that's being done there. Departmental recognition requires submission of an action plan with activities aligned with our 6Cs framework. And we also now offer an APHIS champion designation for individuals who attend 6 of our monthly webinar trainings. And again, you can learn more about this program on our website. Next slide, please. So now we have received a new round of funding from the Johnny Hartford Foundation. Thank you so much to our partners there for phase 3 of age-friendly public health systems, which began in April of this year. During phase 3, our primary focus is to build expertise in healthy aging within the Public Health Institute system, including the development of a 6Cs curriculum to help guide that capacity building. We're also creating state snapshots of healthy aging, and we'll be working with the Education Development Center and National Alliance for Caregiving starting next year to develop public health guidance in preventing and addressing elder mistreatment. Next slide, please. So as you can imagine, there's a lot of work that's happening organically, but there's a lot of support that is still needed and a lot of funding that's not happening through governmental public health systems. There are a lot of opportunities and varied opportunities for funder engagement. I just wanted to mention a few of them, and happy to engage with any of you and all of you at some point on a one-on-one basis as well. So there are still very few states that have comprehensive data dashboards on older adult health. The Mississippi Department of Health was able to partner with the Massachusetts University of Massachusetts. They helped to support development of profiles for Mississippi, and I think Dr. White will tell you a little bit about that as well. But for the most part, state departments of health do not have the support and funding to be able to develop these comprehensive dashboards. We also know of several states where the local health departments would appreciate support for engagement in our recognition program, including Colorado and New York and Tennessee and many others. And as many of you know, states are seeking help in developing and implementing multi-sector plans for aging, which provide excellent opportunities for aligning the components of what we call the age-friendly ecosystem. And if you go to the next slide, and thank you so much again to the Johnny Hartford Foundation, whose folks developed this amazing graphic that depicts the age-friendly ecosystem as we know it today, with the individuals and age-friendly policies and practices at the center, but that includes public health, workplaces, home and community-based services, cities, communities, states, education and research, and healthcare systems. So I'm going to stop here and turn to our partners in Michigan, who will talk to you a little bit about the wonderful activities there and the way the age-friendly ecosystem is coming together in the state of Michigan. So Claire and Jesse, turning to you.
Well, hello, everyone. Once you put up the Michigan slides, you can just go right in to the second slide. Thank you. So we were very excited to work with Tifa and on a project that she mentioned, funded by the Michigan Health Endowment Fund. I'll just say a little bit about what MPHI is. As Megan alluded, there is a national network of public health institutes. We're all a little bit unique. In our case, MPHI was established in 1989 through an act of our state legislature to be of assistance to the department, what was then the Department of Public Health, and which has now, through many mergers and reorganizations, become the full Michigan Department of Health and Human Services. So we have a very close relationship with our state Department of Health and Human Services. And we do a lot of work nationally with various funders, philanthropy, and also locally with communities, with local health departments, et cetera. So as you might gather from this timeline, the project was a bit of a challenge. We were funded officially in November of 2019 with a grant award from the Health Endowment Fund. It was originally envisioned as a way to support local health departments and aging service providers in partnership in a learning and action committee. And then we were going to, develop an assessment and publish some lessons learned and guidance documents from working with the partners who applied to be part of the project. There was a mini grant that supported participation. And we had it all ready, and we're about to hit go in March of 2020. And everyone knows the world changed, and neither aging services organizations or public health had time to participate in anything that wasn't related to COVID. So we just hit pause for a while. And then eventually we did attempt to relaunch the Learning and Action Network and Mini Grantee Program in the fall of 2020. We got one applicant. They were a fabulous applicant. At that point, it wasn't really a learning network. We called them our grantee. The Health Endowment Fund was absolutely fabulous in supporting us and thinking through how to refocus the initiative, and thought that what we should work on is, an environmental scan and a planning process for the rest of this grant, which is what we did. And then finally, in October of 22, we concluded with the statewide convening. So next slide. One of the things that we did early on is establish an advisory committee. Even in the beginning, they were extremely supportive. This lists some of the representation we had on that advisory committee, including multiple areas within the state Department of Health and Human Services, both aging and the local health services division. We had two Michigan local public health departments who participated, and they would come to the advisory committee meetings, from vaccination clinics, from testing sites, wearing their mask, but nevertheless coming because of the importance that they attributed to this work. Our statewide association for local public health, our Health and Hospital Association. We have some age-friendly communities, so we had representation on that front as well. The AARP was an extremely valuable and important partner. A council on aging representing actually the Wexford Council on Aging, that's a county in Michigan, but they were there participating and representing an association of councils on aging, which are usually county-run aging services providers that work together with the AAAs, MPHI, and TIFA. Next slide. So one of the first things we learned, even from our advisory committee, was a little bit of lack of clarity as to what was the age-friendly ecosystem. You know, obviously folks were learning quickly from COVID what some of public health's roles were, but there was still an uncertainty about what should these partners expect from each other. So the first thing we worked on was a sort of, we called it a 101 document to describe the age-friendly ecosystem within Michigan. Michigan is also a designated age-friendly state. And this was just one of the graphics. We had some text just briefly describing each of these entities that we collectively thought made up the age-friendly ecosystem within Michigan, and then tried to put them on this map so folks could see the overlay. But some of the things that were important to describe are the Michigan Public Health Code and how is public health organized in Michigan, and who is public health responsive to, generally or often county entities or other local entities. And they are, you know, required, and their activity is governed by the state act called the Public Health Code in Michigan. And then I think I'm turning it over to Jesse, who's going to talk a little bit on the next slide about our mini grantee and what they did during this process.
Absolutely. Thank you, Claire. Like Claire said, we had one grantee that we supported through this process. And so when we first put together that kind of our request for applications, we were really looking at networks and partnership and sustainability and understanding kind of existing efforts and assets. I think that there were a lot of connections made just because of the pandemic between public health and the aging system that were had to work together to best serve everyone in their community. But we did have one organization that applied, and it was our Branch Hillsdale St. Joseph Community Health Agency. It is a 3-county health department. It's one of our district health departments in Michigan, and is one of 2 health departments in Michigan where the area agency on aging is under the kind of the same umbrella government. So the AAA is part of the local health department. So they already work really well together, and we're well situated for this work. So the major focus of their project was to look at policy and practices within the county, and look at kind of a needs assessment, and then reviewing and updating existing procedures and policies to making sure that they were inclusive of older adults. So on the next slide, it details their process that they went through for this project. So they worked with their emergency preparedness coordinator, and I think the main contact or the main staff on this the grant project was the AAA director for the health department. So she worked with the emergency preparedness coordinator to collect policy documents. They developed a list of key topics that they were looking for in these policy documents, and kind of developed red flags for anything that didn't align with kind of those topics they were looking for, or for the aging population. They provided information on why it was red flagged and how it could be changed, and then worked with the emergency preparedness coordinator to talk about making those changes. The grant allowed them to dedicate staff hours to this process, and they created new age-friendly living language to update those policies. They presented them to the health officer and to their Board of Health for approval, and then were able to implement several of these changes. So it was really exciting to be able to support kind of this careful full look through of policies for the health department and emergency preparedness, and be able to update those to have a focus and support of the aging population in their 3-county region. So I think I'm handing it back to Claire for the next slide.
Right, so the next slide is to the environmental scan. So 2 main activities comprised our environmental scan. One was a review of the community health assessments from across the state to better understand the extent to which there were partnerships in the community health assessment process between aging services providers and public health. And another one was a survey. We had 2 versions of the survey, one aimed at public health departments and one aimed at aging services providers. And the findings, well, COVID-19 had a big impact on folks. I'll review some of the findings in a little more detail in the next slide. But in terms of that middle box, our initial hypotheses that the main place where these partnerships of aging services providers and local public health could start were on emergency preparedness and community assessments. And that was confirmed in the surveys that we did. And then that there's just a ton of variation across the state of Michigan in the extent to which aging services providers and local public health are integrated or perhaps just collaborative, or maybe in some instances, relationships could be improved. So the next slide's got a little bit more detail from the scan. On the top there, from the community health assessments that we reviewed, these were all health assessments that had been submitted 2019 or earlier, so representative of pre-COVID times, and we reviewed about 20 of them. I probably should mention that Michigan has 45 local health jurisdictions. And what we found in our review of 20 community health assessments was that about 5 stood out as bright spots for intentionally engaging older adults in the community assessment process. The vast majority presented data on older adults along with other age groups, roughly. And then in the survey, this was confirmed, and there's some data there. We asked this particular question, we asked a number of questions, but this question was, how do you engage older adults in your organization's assessment and planning process? In general, we found that surveys were by far the most common, using perhaps some of you have seen a community engagement power ladder, or we would consider active collaboration a more robust way of engaging community members than surveys, but surveys are the most common. And however, roughly half of the local health department survey respondents did report seeking out participation from older adults or elders in the assessment and planning process. I should say from the local public health, we had about a 33, about a third of them responded to the survey. And the percentage was higher among the area agencies on aging. But so, it's some response. It's not universal representation by any means. The next slide. One of the things that we found we did especially in our document assessment is that, based on the robustness of inclusion of older adults, the actual results were different. So those assessments tended to find things that really popped out as being specific to older adult populations, and concerns related to the cost of medications, concerns related to the cost of housing as being a barrier to living independently. And there were some others that you could just tell that when an effort was made to more inclusively include older adults, the results were somewhat different, whereas other CHAs and CHNAs tended to find a lot of emphasis on chronic chronic conditions and things that do disproportionately affect older adults, but are probably less surprising. So this is a finding that we published in our report out of the process and the environmental scan, that less common practices for inclusion of older adults should be more widely adopted. Partnerships with older adults and aging services agencies throughout the assessment and planning process, asking questions that specifically address older adult concerns, and seeking out settings and opportunities that are accessible for the older adult population are some recommendations that came out of our environmental scan. The next slide has some information from what was on the wish list of local health departments and older adult service providers. And in general, the entire project did affirm, one of the questions that Megan asked initially, like, would the aging service providers welcome support from public health? Yes, our project found that as well. And these were some of the ways that both local health departments and older adult services providers wanted to work together on outreach, education, addressing place and addressing social determinants of health, referrals, and adult immunizations. And the next slide. Finally, we asked them, well, what support would you need in order to accomplish this wish list? Of course, funding and staffing were the response from almost everyone, but there are some really other interesting things, some of which affirmed that early work with our advisory committee, that these partners are not in all cases sure of each other, and how their roles could be complementary and not duplicative. So they wanted some assistance understanding their respective roles, and a process to work together to establish a clear vision. Communication would help. And interestingly, on both sides, they talked about needing possibly political support and political will. And I think I'm turning it back over to Jessie to start the next slide.
You are. So as Claire indicated, this work kind of culminated I think Claire indicated, it culminated in a statewide meeting where we brought folks together from the aging, health, and public health sectors to kind of learn what had happened, reflect on what had happened, and come up with some recommendations. So it was a day-long meeting. It was one of the first opportunities I personally had to see a lot of partners in person following the pandemic. So there was a lot of excitement in the room. I think I wasn't the only one there, but also just a lot of relationship building that happened that day as well, which we saw was important. So we had folks from across the state in the room. We presented on age-friendly initiatives. We, kind of what is age-friendly public health. Our grantee presented on their process and information. So we kind of spent the morning uploading a lot of information to participants, and then spent the rest of the day in some collective reflection. And so we asked people who were there to reflect on what they thought was most important to lift up from what they heard to create age-friendly systems, as well as reflecting on their own experiences. And we asked them also kind of what are supports and barriers to this work in their communities. And so they talked a lot. I think everybody, again, was glad to be there in person. And so the recommendations you see on the screen emerged from the feedback that they provided to us during that day. And so some of the things that they said we should work on next. The first is really cross-sector partnership and learning about each other and what everybody does so that we can effectively arrange and partner to support older adults in our communities. We talked about adopting a strengths-based approach and changing a narrative that reinforces ageism. So, what strengths do older people have, and how can we support them best? As Claire shared, kind of engaging older adults early and often throughout programming. So from, looking at data to see what needs are through program implementation, monitoring, and evaluation, it's important to have them there engaged in the process throughout. And really the need to be intentional about including information about older adults in our work. There's a lot of assessment planning work that goes on in public health, especially, but also in other settings. And so kind of keeping older adults in mind, as well as kind of subgroups of older adults, those populations that have or face disparate health outcomes that need to really be focused in on to support. As we've been talking about this, Megan shared kind of their latest resource earlier that we're also very excited to see that will be really helpful in a lot of this work. And so looking for opportunities to bring in the aging sector into community health assessments, emergency preparedness planning, and then working on creating more age-friendly communities across the state. So then on the next slide, which I think is our final slide, kind of what we are working on since then. You know, kind of business in public health is getting back to a standard business here in Michigan. And so some of the things that are happening now is to create partnerships between aging and public health, the public health administrations at the Department of Health and Human Services. So those are in two separate administrations within the department. One of the things that's happening that's exciting for both sides is there's a new dementia unit at the State Health Department. So that's within the Public Health Administration that's being put in place, and they're really excited for the opportunity that brings for partnership between the aging administration and the Public Health Administration. We also helped facilitate Michigan's most recent state plan on aging, and a lot of the priorities there had to do with partnership, had to do with learning about what other organizations in the communities do, and you know, what the aging sector can provide to support older adults and public health system. And then one of the next things is happening is that Michigan State Health Improvement Plan is going to kick off soon. And so we are advocating for inviting aging system partners into that process, building on the work that just happened in the state plan on aging, and really kind of putting these perspectives and you know, this approach into the work as we move forward. So I think that wraps up for me, and we're handing over to Kina.
We are. You may not see me yet, but good afternoon, and thank you so much to Grantmakers in Aging for allowing Mississippi to be representing our work today. Next slide. So just a bit of a landscape about Mississippi. So we again are the State Department of Health, the only public health agency for our state. And we are a centralized governance structure. And the reason I share that is because when Florida was initially an award recipient of the Age-Friendly Public Health Systems work, they were very decentralized. And so for us to think about how this would work in Mississippi, we really had to be innovative, given that we are a centralized governance structure. We have public health accreditation since 2017. So Megan shared the work that they've done working with FAB to integrate healthy aging into the accreditation practices. And what we did was take those recommendations at the early onset of our work to really see how those recommendations could then support accreditation, but also our movement towards that life course approach in public health. We do have 82 counties across our state, and greater than 16% of our population is aging. And so we received our award October of 2020 through April of this year. We did receive our award in the height of COVID response, but I will share, we had a very aggressive team. And so I am not sure that we lost any steam in our progress across the height of COVID. So really excited to see that work. Next slide. Back up one. So we, at the beginning of receiving our award, had to decide exactly how we wanted to structure our flow. Again, being centralized, we knew that there had to be a framework of sort for us to really think about next steps of a real multi-sectoral collaboration. And so one of our advisory committee leads recommended we consider the collective impact process. We did review the collective impact process, and we knew that a shared agenda was probably the most compelling component of the process. And so as a group, we adopted very early on as an agency this process to lead our efforts in developing an age-friendly public health systems in Mississippi. So I'll share with you, there's 5 major components of this process for those who are unfamiliar with it. But again, having that common agenda, having data throughout the process, and having it being a very cyclical, we continue to go back and discuss throughout our development of our work exactly what was working and what was not. And so I'll share some of that as I speak. Next slide. Similar to Michigan, we had both an internal and an external committee. Our external advisory committee was definitely multi-sectoral, and that's probably the shining star of our work, as we really were able to pull in some amazing partners across the state. We had a representative from Age-Friendly Health Systems work in our state unit on aging, which consists of our Mississippi Access to Care Network, our AAAs, our planning and development districts. They were all on board and more than willing to serve in our work. We had our Alzheimer's Association state chapter, AARP was at the table, Medicaid, our state medical association. So as you can see, we really had a large group of external partners very invested in understanding how Mississippi could advance our age-friendly work, and then also how they could be a part. As a complement to this external committee, we also had an internal Learning and Action Committee, which was representative of about 15 public health directors across various programs, including emergency preparedness and others. And so at the time of developing our system, we had both an internal environmental scan and an external, just to really understand what was happening across our state. Next slide. In engaging these individuals, this was the process we used. Although this is one slide, this covers at least 2 years of work. And so again, as we selected the collective impact approach, we did our environmental scan, both internal and external, to see what were our current best practices in public health, but also outside of what we were doing, who was doing what the best and how we could learn from them. We educated our advisory committee on this process. We developed an interview guide. We conducted key informant interviews with key partners to really understand this work and what this would mean in Mississippi. We had a theme analysis, of course, for our interviews to make sure that we were evaluating our true effectiveness. In this process, we presented our findings of those interviews to both our internal and external networking committee. We developed a draft work plan, and I'll share a little bit about that plan in a future slide. But this plan was designed to be similar to a multi-sectoral plan on aging, where we utilize the age-friendly public health systems at the time, the 5 Cs initially, to really create that common agenda for our work. We disseminated this plan both to our committees, our network, but also the public. We wanted to ensure once we put together a plan that it was something that could be well adopted across multiple partners in our state. And once we received that feedback, we finalized the state plan. So although this is one slide, it represents a wealth of work that we've done across our state. And I'll delve into more of that in just a bit. Next slide. So at the time of working on our plan, as I shared, we initially worked with the 5 Cs. Megan briefly shared an infographic for the 6 Cs. I love to share that. I feel like Mississippi was a strong influence to incorporating a 6 C to the national work, because when we did our initial key informant interviews, several elements stood out and did not fit within those 5 Cs. And so we recognized that policy systems and environmental changes were not included in the initial 5 Cs, and that leadership component was not there, and the financial security of older adults, et cetera. And so we added a 6 C to our plan prior to the national movement. And once the additional 6 C was added, we adjusted our plan to reflect that work. Next slide. But it really allowed Mississippi to think through how we frame each of those 6 Cs and how we develop goals, strategies, action steps, and key indicators for this. And as I mentioned, we definitely had a multi-sectoral advisory committee. So it was not easy to have complete consensus at the very beginning, but by the end of developing this statewide plan, we were able to really strengthen our collaborations across multiple sectors and have that commitment and support. And one thing I will share as a part of this, when we conducted our plan, we actually compared our plan to our state unit on aging plan, our state health improvement plan, and others, because we wanted this to be complementary and not duplicative. And so we also looked at our social determinants of health component of our state health improvement plan to ensure that we prioritize older adults. But we were very impressed with the commitment from our partners to really say this plan is needed. It's not something that's just an object on a shelf, but it's really a way for multiple sectors to get together and identify what are these key issues and goals that we need to address, and how do we address these over a next few year iteration. And so our plan was adopted by our advisory committee, adopted by public comment, as well as our state health officer signing off to support this statewide public health plan. So that's a huge win for our state because it's something we had not had before. And it definitely served as a model for collaboration across sectors so that we all understand there is opportunity and space to really leverage our resources, but also indicate where there's gaps and weaknesses and where we can come together, where we may not all have funding, we all have commitment, and we can support each other in accomplishing goals that support the advancement of older adults. Next slide. As a part of our development of that state plan, we recognized early on that similar to other states, Mississippi did not have comprehensive data for older adults. And so with a recommendation from James Fuchian with the Massachusetts Healthy Aging Collaborative, he recommended one of his great partners, Dr. Beth Dugan at UMass Boston. We met with them and developed a phenomenal partnership whereby they developed for Mississippi the first ever healthy aging data report and county level data profiles for all 82 counties in our state. And so we were so excited to receive this information, and it now gives Mississippi a lens into exactly what is happening with older adults in our state. It frames a health equity focus and looks at those disparities for older adults, but also allows us to look at chronic disease indicators and others that really tell the story of what's happening with older adults and allows us to build and plan on what we need to do. We were able to have interactive web maps as a part of this. It also included technical documentation for those researchers who want to really understand how this data was developed. But probably the most exciting component of this is we're direct mailing a copy of the report and data profiles to all of the municipalities across the state. And we're currently in progress of developing a data dashboard similar to what Florida has for the state of Mississippi. So this is just a huge win of information that is now ready available in our state that previously was not available before this work for age-friendly public health systems. Next slide. Megan shared, but as a part of this development process, we wanted to commit to being a recognized age-friendly public health system. And although there is an official recognition program, we wanted to stay true to what initially started out as the 10 steps for receiving age-friendly recognition. And so we did that through a lot of collaboration and a lot of effort. TIFA recognized Mississippi, as you can see on the slide, in May, as being an age-friendly public health system as an exemplar status. I myself am recognized as an individual champion. And so we really not only commit to this work, but want to ensure that this is not just an initiative, but this is an integrated part of what we're doing in public health. And so we do have a stand-up Healthy Aging Bureau now, and this is a part of that bureau, and it allows us to work across multiple departments and across multiple sectors throughout the state. So we're very excited to have that recognition and hope to continue moving forward with other champions across our state being recognized both individually and at a department level. Next slide. So we did host our first ever Healthy Aging Summit during Older Americans Month in May of this year. You'll see some friendly faces on the slide. We have Dr. Dugan is first to the left. We have Dr. Aaron Guest, who spoke about rural health. We have Melinda Bertucci, who represented our AARP state office. We have so many individuals. We have the National Reframing Aging was represented for us. We have Dr. Edney, our state health officer. Megan is on the slide, Dr. Phillips. Liz represents Alzheimer's Association. So it was, Mandela is here for AARP nationally. It was just a wonderful day. It was a one-day jam-packed opportunity to talk about ageism, age-friendly communities, to talk about healthy aging data, and what we want to do next. So the first half of the day was really listening to presenters. The second half of the day were breakout sessions where we really engaged our attendees in understanding what's next, and based on those 6 C's framework, because we wanted everything to be intentional back to our plan. And so we have phenomenal feedback that we received about what our community partners need to be successful in moving forward, and exactly how we as a public health system can continue spearheading the ecosystem development across our state. And so we have asked our team, would they like to have a summit annually or every other year, and overwhelmingly everyone wants to do this every year. So we're already in the conversations early about what this could look like next year for Mississippi. Next slide. So as a part of building our ecosystem, and Megan shared a new infographic that I'm so excited to add to our next presentation. But for today, just to share, prior to receiving our age-friendly public health systems funding, Mississippi only had 5 age-friendly communities in our state. So our public health agency is now recognized. We also are working very closely with our land-grant university, Mississippi State, who is pursuing age-friendly university status. And we're also collaborating with the University of Mississippi Medical Center, the MIND Center. They are our academic medical center research institute specifically focused on Alzheimer's disease and other dementias. They are pursuing accreditation in their division of geriatrics. And so Marion General Hospital was also a part of the Age-Friendly Health Systems Initiative when it began. So as you can see, we're really trying to advance these collaborations across multiple sectors to understand that the older adult demographic shift is coming and we have to be prepared for it. And so every day we hear from a new partner that's interested in joining the ecosystem and being part of this work. And so our next collaborator that has reached out is a local institute that's interested in becoming an age-friendly employer. So we're really excited to bring that wealth of engagement to our ecosystem development. Next slide. So specifically what's happening for Age-Friendly Mississippi, as I shared, we only had 5 age-friendly communities when we started with this work, and we are collaborating with AARP Mississippi to work in establishing new communities. But just to show how synergy and collaboration works, Mississippi is also a recipient of the CDC BOLD grant, which focuses on Alzheimer's disease. We now are a partner with US Aging and will begin establishing both age and dementia-friendly communities across our state. I do have an infographic on the slide entitled Better Together. If you have not familiarized yourself with this document, I definitely recommend it if you are interested in age and dementia-friendly communities working in tandem. It's a great read that shares how you can do that successfully. We're also working with our state AARP chapter on a new initiative entitled Healthy Aging Champions, which I'll share on another slide. And then also in the height of COVID, the National Association for Chronic Disease Directors had an initiative entitled BRIC, Building Resilient Inclusive Communities. And through that, our age-friendly work, we focus specifically on social connectedness for older adults. We piloted social isolation initiatives with our Central Planning and Development District. And we also address food insecurity for older adults. And at the height of COVID, we also collaborated with the local AAA for our homebound older adults for vaccine and testing support. I initially shared on the previous slide, we're working to develop age-friendly health systems. And I just want to give a plug. If you do have a regional Alzheimer's Association's health systems director, I highly encourage you to reach out to them. We're working with our regional health systems director with the Alzheimer's Association to establish more age-friendly health systems across our state and also focus on geriatric emergency department accreditation. And then I shared Age-Friendly University as we address not only our needs for our universities, but also intergenerational activities is something that we're currently advancing in Mississippi. Next slide. So the Healthy Aging Champions Initiative, Michigan shared how important it is for older adults to have a voice in this work. And so we've established an initiative with our State Public Health Association and AARP Mississippi to do just that. We're engaging older adult volunteers in this work. We already have commitments from over 25 volunteers that want to just be a part of sharing this message of healthy aging, providing a voice to us about pertinent issues that are affecting older adults across our state. And what's most exciting is the majority of the volunteers are retired public health professionals. They're individuals who've had years in public health that are so dedicated to their work. And now they want to be a part of this. And so having their historical knowledge has been amazing because we're learning exactly what we need to do to really reach our older adult population and how we can improve the built environment for them from them. And so it's a great way to engage their voice and address intergenerational needs, as well as really being age friendly. Next slide. And not to forget that caregivers are so important to what we do with older adults. And as a part of the national strategy movement, we are very committed to supporting our caregivers, and that is a significant part of our work. And so with our state caregiver coalition, we do have representation and are identifying some of those state actions that we can take as a part of our age-friendly movement to do this work. We do have caregiver support for various chronic disease programs and coalitions, but we want to look at all family caregivers and not those just specific to a chronic condition. And so that's another key part of our work in our state. And I think I have one more slide. Next slide. And so lastly, I just want to share, we are advancing age-friendly in Mississippi. We have a vision, we have values that have been adopted, and the goals are just to be successful. And we learn from other states. Florida, Marcy, and Washington is doing amazing work with the tribal community. And so we learn from others how to be great. And so we are definitely just continuing to support our older adults and just be an open opportunity for success, because we know that all of us are aging, and we have to be prepared to protect each other. So thank you all so much for the opportunity, and I'll turn it back over to Emily.
Thank you so much, Dr. White, and thank you to Dr. Tanner and to Jesse. I am going to pull everyone back. If everyone could put their cameras back on. We are running short on time, but not short on information that has been shared. It's you're doing some tremendous work in your states, and I so appreciate what you've shared today. So I thought, instead of doing a bunch of questions, I would just ask this one big one, and that is, how do you think the work that you have done, the groundwork that you've laid here over the past couple of years with this movement, is setting you up for the next 10 years for your state? And so anyone can answer that, but what you've talked so much about, the cross-sector work, engaging different partners, really expanding this outward. And I just wonder, what do you think the impact of that is as you face the next 10 years in your state, and how you work to support older adults?
I can answer real quick. I'll just say the impact is empowerment. I think that now that we have created this statewide action plan, and we've brought together so many different partners who felt their voices were very silent or embedded, they're now empowered to say, yes, this is important work. The older adult population is important. And just having this as a key component, as Megan shared, as a part of public health. It's not an add-on, but it is definitely a priority, I think, has made for Mississippi, this work will stand for another 10 years plus.
That's great.
Well, Jesse reviewed some of the things that are happening in Michigan, and I think change is incremental, as we mentioned. A lot of change needs to take place at the local level, and both the state agency certainly the state agency can support local level folks in making these connections. I think there was just an admission that you have to start somewhere. And part of the way to get over these initial hurdles is just to start collaborating and communicating at the local level. I do want to say I'm excited to hear about phase 3. I think public health institutes, as sort of independent third parties, can play an important role in supporting folks to get together and develop local sort of plans. Jesse, did you? Yeah.
Yeah, I was just going to say, I think just kind of, Claire, you had shared kind of our impetus at Michigan Public Health Institute, that we were built to support the department. And so we have a role in these two different sectors in our state just because of where we sit. And so I think, the work we've done and the work that's being done with public health institutes really helps us be positioned to bring this perspective to a lot of our work, which I think the more we talk about it, the more we infuse it into our work, the further we'll get.
Megan, any thoughts on the national front? You've been part of this work for a long time.
Thanks, Emily. Yeah, no, I think the only thing I would say in closing is that every state is different, and approaches need to be different for every state, depending on what's already happening or what isn't happening. But partnerships are key, as you've heard, and leadership is truly important. So just appreciate all the work that's happening in Michigan and Mississippi, and thank you so much.
Thank you. Thank you to all of you for this great conversation. And thank you to everyone who's joined us today. We will be sharing a survey after this, so please complete it to help us improve our programming. Please follow us on Twitter, Facebook, LinkedIn, all the things. And thank you to everyone for joining us today. And we hope that you have a great summer. Thank you.
Thank you.